for having me. I've been here several times to this group, so hopefully this is not redundant for most of you. So I'm Cath Glennon. I'm an oncology nurse by background. So I've been in oncology nursing, oh gosh, many years, over 35 years. And in the oncology population, just like in the stroke population with chronic illnesses, a lot of times there's sleep challenges. And so that's what we're here to talk today about. I'm going to focus on a few things specifically about stroke, but those as well, stroke and its implications for sleep. But also if you are a caregiver and you're also having sleep challenges, hopefully this will help you as well. So today we're going to talk about why is sleep so important, what happens during sleep. Oh, sure. Down?
Yes.
Gosh, I feel like
I know.
I'm what happens during sleep? Ooh, that's too much, isn't it?
That challenge is good.
Okay, okay. As long as you guys, if I'm not irritating to you, if I'm irritating, hold up your hands. The common sleep issues and causes of some of the sleep problems, and then especially approaches to better sleep, right? So hopefully we can learn a few things. So restful and adequate sleep provides a foundation of our optimal performance in daily life. So in order to do our best today, hopefully we slept well last night, and on and on. So we must have our sleep to perform at our optimal level. And also, what you'll see is when you talk, it's not just about performance, but a lot happens during our sleep that we need to ensure that we get our time for very solid sleep. So we know that sleep insufficiency, which means not obtaining enough restorative sleep, is a public health issue. And it's linked to more accidents, more car accidents, industrial accidents, increased healthcare utilization because of that, and decreased work productivity. Now, it's such an issue in the United States that CDC is on it. And CDC, the Centers for Disease Control and Prevention, the same people that watched us and got us through COVID are on our sleep deprivation because it affects the US population. So it's such an impact on the US population. So they are tracking it, and if you ever see studies from the CDC regarding sleep, please take a look at that, because they've been tracking it for a long time, because we know that just like they've identified, there's so many more negative consequences from not having enough sleep, more than just us feeling lousy. Excuse me, some of the most devastating historical events have been caused when they went back into the root cause analysis on why certain things happened. In history, they noticed they could see a link flaring to sleep deprivation. One was Chernobyl. We all remember what happened and the spaceship Challenger explosion. They can link those kind of events to lack of sleep. So we can see how important it is. Also, about this oil spill with Exxon. So not getting enough sleep is associated with an increased risk factor for a number of chronic illnesses like high blood pressure, diabetes, depression, obesity, cancer, early mortality, and reduced quality of life and productivity. We know there are things there. And everyone, or the healthcare field, recognizes that sleep is one of the most powerful pillars of good health. So we know we're supposed to get exercise, we're supposed to eat properly, right? We're supposed to do that, but sleep is one of those foundational elements that we must also pay attention to, just like our diet and our exercise pattern. Only 1 out of 3 Americans say they get sufficient sleep on a regular basis. So that's only 30% of our US population, 33% say they get sufficient sleep, and I'm gonna identify what sufficient sleep is according to age. But, that means by far the majority are not getting sufficient amount of sleep. Now let's look at stroke specifically. Stroke is the leading cause of disability and mortality all over the world when we look at it globally. And due to an aging population, we know that the incidence of stroke is rising significantly. And there's thus causes significant challenges for many of our patients. In addition to the traditional risks that we've always known, age, high blood pressure, high cholesterol, diabetes, AFib, sleep disorders is another risk factor for stroke. And they're doing more and more research into this area. Common types of sleep disturbances are insomnia, hypersomnia, sleeping too much, breathing-related sleep disorders, and parasomnia. And we'll talk about those. So parasomnia is a catch-all term for unusual behaviors that people experience prior to falling asleep, while they're asleep, or during the arousal period between sleep and wakefulness when you're trying to wake up. These behaviors vary in characteristics and severity, such as sleepwalking, sleep paralysis, night terrors, and they are more common in children than adults. But these issues or diagnoses have been identified in all age groups, not just in children. These are some of the types of parasomnias. So the non-REM, you've heard of REM sleep and non-REM sleep probably, and I'll talk about that in a second. But non-REM includes confusional arousal when you're trying to wake up and you're confused. Sleepwalking, night terrors. REM related includes some sleep behavior disorders like sleep paralysis, nightmare disorders, and excuse me, in this other category, exploding head syndrome, which is a type of parasomnia where you feel like your head is just going to blow off. Sleep-related hallucinations and bedwetting. Those are all part of this parasomnia that can influence the sleep pattern. So back to risk factors with stroke. We already talked about some of the traditional risk factors include AFib, if we're over 65 years old. Even though stroke is, we see in the literature all the time, stroke is becoming a younger age issue as well, isn't it? It's affecting those much younger than 65. High blood pressure, heart disease, coronary artery stenosis, when our arteries here, especially in our neck, our carotids are narrowing because of plaque or high blood pressure, whatever. Tobacco use, diabetes, and hyperlipidemia, high fat or cholesterol. And again, there's increasing evidence of sleep disorders, including those we talked about, which includes sleep disordered breathing, like sleep apnea, insomnia, hypersomnia, the parasomnias we just talked about, sleep-related movement disorders. Those are all can be contributed or be risk factors for stroke or contribute to a stroke. Therefore, the identification and treatment of sleep disorders is very, very important. So if you in the audience are caregivers or people that have not experienced a stroke, these are all things we need to pay attention to, hopefully to prevent a stroke. Oh, and another big one is depression. So depression after a stroke is very prevalent and closely related to sleep disorders. And there are ways to treat depression that will help you overcome some of your sleep issues as well. So depression, which takes a little bit more digging, you need to discuss this with your doctor or healthcare provider, your nurse practitioner, your physician assistant, whoever you're following up with. Because depression can influence sleep, but it is something that we can intervene and help you with, usually through a medication, but also through support groups different, it doesn't have to be just a medication, other areas like talk therapy, seeing someone about the depression. Now, whether you're a stroke patient or not, here's our regular sleep cycles. So you can see here, stage 1, that says the lightest sleep. So we're just falling asleep here, we go deeper, deeper, deeper. This is your deepest sleep, this is non-REM. We have several different cycles during the night. So we have our REM sleep here, we go down, go deep again. Here, now notice these are shortening, so as it's time to wake up, we're having shorter sleep cycles. We need to do that because eventually we need to get out of bed, right? But we need to, so you can see at the beginning of our sleep pattern, and that's if we sleep, night shift workers, they're sleeping during the day. So it doesn't matter if you're a day sleeper or a night sleeper, you're gonna go through these same sleep cycles. We usually have about 4, 1, 2, 3, 4, or 5. And then we wake up here. So you can see we fall asleep, we go deep into sleep, and then we start waking up and we wake up over here. The REM is the rapid eye movement when we're in a deep sleep. Now, another way to look at it is stage 1 is nodding off, and that's what we call cat naps. So as you're nodding off, you can easily wake up. You're just, starting to fall asleep, but that's called cat nap. You're easily aroused. You can wake up quickly. But stage 2 is when you're going a little bit deeper. So that's a power nap. Power naps are really great too. A lot of businesses in the United States have accommodated their employees with sleep rooms or quiet rooms where they can actually go in and take a power nap because we find that it does rejuvenate you. Stage 3 and 4 is the beginning of deep sleep where there's no eye movement or muscle activity. It's more difficult to wake up in, but we have to get into these deep sleeps because that's where our body repairs itself. Our muscles and our tissues are repaired during this time of deep sleep, and only in stage 3 and 4. It's not going to happen in stage 1 and 2, cat naps or power naps. We need to get deeper. And this is what stimulates growth and development. It also boosts our immune system. Toxins are expelled during our through the lymphatic system during sleep. And I'm going to show you a little film that will show some of that. And it builds energy for the next day. Rapid eye movement sleep is about 90 minutes after falling asleep. That's when you go into rapid eye movement sleep, and that's where you dream. Each REM or rapid eye movement stage lasts up to an hour. Adults usually have about 4 to 6 cycles during a night of REM. And this REM sleep is an important role in memory and learning function because your brain will go back. What did I learn today? If I'm taking piano lessons, learning a new language, whatever I may be, what's new that I'm exposed to today is going to be consolidated in my memory during this phase. So it goes into our long-term storage during the REM phase. Oh, am I walking? Am I standing? Gosh, I hope not. I'll move back. Sorry. Oh, here's the clicker. Let me just use that. So dreams occur in REM sleep. Most of us dream at least 4 to 6 times each night. Remember, we have about 4 to 6 REM cycles per night, so we may dream about 4 to 6 times per night. There was a French study done not that long ago that found that some people think they don't dream. No, I don't dream. That's usually not true. All people dream. It's just a matter of if you remember. Now, the good thing about dreaming is we have less paralysis because during this dreaming or REM phase, you lose all functionality of your muscles. Because if you're dreaming that you're falling off a cliff or you're in a fight beating someone up, you don't want to beat up your bed partner, do you, or fall out of bed. That's why with muscle paralysis, we're unable to carry out those actions because we're unable to because of the paralysis of our muscles. So that's a protective feature, which is great. So again, just to reinforce, we have about 4 to 5 cycles of sleep. We start off falling asleep, tap nap, easily aroused, go deeper, deeper, and then we start waking up when we get down here to the right hand side. Another way to depict it is stage 1, light sleep. Our muscle and brain activity decreases. Stage 2 is our eye movement and muscle activity stop. Our brain waves slow down. Hooked up to a sleep study machine. We're hooked up to the electrodes. We can see that stage 3. Our brain really slows down and causes very low, slow delta sleep waves. And then during REM, our heart rate and blood pressure rise, our body's paralyzed, and our eye movement is quick and dreams begin. Okay, now I'm going to show you the film here that I like. I should be scared. Yeah.
Savor the sweeter things in life with Culver's new concrete mixers and lemon ice coolers made with fruity Skittles popped.
If your dream is to become a nurse, WGU's pre-licensure nursing program is here to help you make it a reality. Our program blends online courses with hands-on clinical experiences. And WGU's low flat rate tuition and scholarships make earning your degree even more.
Every mammal sleeps.
This is done, this is a physician, video here. Stanford and, worked with Canada, group on this.
Every mammal sleeps, and there are a lot of theories, but
Oh, I see. Yeah. Okay.
there's no real proof of why we sleep because it's hard and test the result.
That's Dr. William.
Well, we tested the video, but not the sound. That was super smart, right? We'll get there. But this video for sure has sound.
I just tested this one. That's what I see.
C. Dement, one of the fathers of sleep medicine. If
Oh, well, if we know that, if we can't capture it, we'll start it.
I feel like it's like something nice. That should be one. All right, let's try this again.
Tornado test.
And there are a lot of theories, but there's no real proof of why we sleep because it's hard to eliminate sleep and test the result.
that's Dr. William C. Dement, one of the fathers of sleep medicine. If he isn't sure why we sleep, we can at least try to understand what happens when we close our eyes at night.
I'm at a sleep clinic about to get a sleep study done, and it's going to be a 2-hour test. It's not going to be the typical 8-hour test. So let's see what my brain says about my sleep. I guess I really am sleeping on the job.
Sleep was once considered an inactive state in which our body and brain simply shut down to rest. Scientists have since found our brains are actually highly active during sleep, and our brain repeatedly cycles from one stage to another. Within the first 90 minutes of falling asleep, we enter REM, which stands for Rapid Eye Movement. This cycle was only discovered in 1953.
I would go in with a flashlight and there was a person would be sleeping and lo and behold, I would see the rapid eye movements. They're actually very easy to see if you're sitting next to the sleeper.
This cycle, our brain is almost as active as it is when we're awake.
Something very unusual happens. So the heart beat will be irregular, breathing will be irregular, and changes in brain temperature control in the brain occur.
It's also the stage when we're likely having very vivid dreams, which is why our body is essentially paralyzed. This lack of muscle activity is known as atonia and is believed to be a protective mechanism to prevent us from acting out our dreams and getting injured.
In non-REM, the body is in a much quieter state. The brain waves become slower and the eyes remain still.
It's divided into 3 stages, N1, N2, and the deepest stage of sleep, N3.
It's very hard to wake up out of N3. If you took a 30-minute nap and somebody wakes you up, sometimes you feel lousy. And that's because your brain is in a different chemical state.
N3 is also when the supply of blood to the muscles increases and the body repairs and grows tissue, which brings us to why sleep is so important.
Sleep allows the brain to reorganize. The wiring of the brain adapts in the night. There's also a role for sleep to clear out metabolic waste. Junk, misfolded proteins get washed out,
including proteins that can lead to Alzheimer's disease and dementia. It's known as the glymphatic system. Think of it as a self-cleaning system that flushes away all the neural garbage clogging up our brain. While we're asleep, cells in the brain shrink by 60%, creating more space between the cells and allowing cerebral spinal fluid to pump more easily through the brain tissue. Generally, adults need 7 to 9 hours of sleep, typically done in one shot. But it hasn't always been this way. Evidence shows that for centuries, our ancestors had a first sleep and a second sleep. They would often wake up in the middle of the night to read, pray, or engage in other activities, and then go back to bed again. This all changed after the Industrial Revolution, and thanks to Thomas Edison, the spread of electricity ignited a change in routine.
Cultural attitudes shifted, unleashed by the Industrial Revolution, privileging efficiency, profit. People became increasingly time sensitive.
Today, a third of Canadians are not getting enough sleep. Over 25% of the population suffer from sleep disorders, and if you set an alarm clock, chances are you're sleep deprived.
Setting an alarm clock is sending a signal to the brain to get up before it would naturally tend to do so.
Insufficient sleep is associated with health issues like obesity, cardiovascular disease, injuries, depression, and reduced well-being. On the other hand, oversleeping isn't much better. The world's largest sleep study held at a Canadian university recently found that if you sleep too long, it's almost as bad as not getting enough sleep. All this is dictated by our circadian rhythms, a biological clock that does not have a snooze button. It keeps our body in sync with the cycles of day and night and is synchronized to the rising and setting of the sun. In the morning, light sends a signal through the eye into the brain's hypothalamus to the master clock, called the suprachiasmatic nucleus, or the SCN. The SCN then tells the rest of the body to raise body temperature, heart rate, and blood pressure. Our alertness and concentration sharpens, and our body is ready for a new day. When there's less light, like at night, the SCN tells the brain to make the sleep hormone melatonin. So you get drowsy, the organs start to slow down, bowel movements are suppressed, and the body temperature cools. For most adults, the biggest wave of fatigue comes in the middle of the night between 2 a.m. and 4 a.m. The second lull comes just after lunch around 1 p.m. and 3 p.m., which is why you shouldn't necessarily feel guilty about craving an afternoon nap.
But there are many ways to confuse the master clock, like exposing yourself to digital light while binging on your favorite YouTube videos before bed.
Or working odd hours and traveling across time zones. So what is the best way to fall asleep and stay asleep?
Letting worries and thoughts go, counting sheep, just kind of a meditative kind of process.
And while there is no blanketed solution to get a perfect night's rest, one thing is for sure, there's no way to get around the need for sleep.
2 hours already.
So, what I said earlier is, during that sleep, you saw the brain where the fluid is going through the brain, that's where we're getting rid of the toxins that they have. It's been, we know now that the lack of sleep chronic sleep deprivation can influence being prone to Alzheimer's and dementia. So it's, because after during sleep is when we get rid of those toxins through that lymphatic system that they talked about. So the sleep is a function of the brain. We may feel like we're going to go to sleep because our bodies tired, but actually it's our brains. Our brain will need our body to sleep. Also with stroke, sleep is critical, but sleep problems may follow stroke. Poor sleep can slow our recovery. And you now already have depression, but lack of sleep can enhance the depression too, post-stroke. It also causes memory problems and nighttime falls, which is a huge issue, isn't it? To be more prone to the nighttime falls. The good news is there are ways to improve sleep. Approximately 50% of patients may present with insomnia during the first few months after stroke. I'm sure you guys could tell me how true that is for you, that about half of the patients say this. 1/3 of patients present with insomnia for the first time, and remaining patients already suffered from it previously prior to their stroke. Insomnia after stroke is usually due to environmental factors or comorbidities such as depression. And insomnia may be directly related with the brain injury. It was reported that the left hemisphere decreased non-REM sleep and right hemisphere influences the REM sleep. So regardless of which body of the brain your stroke took place, they're both can be influencing the sleep post-stroke. So insomnia is not sleeping as you should. That's the simple definition. Insomnia is not sleeping like you should. It's having trouble either falling asleep or maybe even fall asleep on days. So these are some of the daytime effects of insomnia. Feeling tired and unable to sleep throughout the day, have trouble with and disruptions in work or social functions, delayed reflexes, mood disruptions, especially when more irritable, and slow thinking or trouble concentrating. Those are all daytime impact of lack of insomnia. And again, insomnia can occur as a risk factor before stroke, not just after the stroke. Studies found that short sleep, less than 5 or 6 hours a night, could reliably predict stroke after adjusting for other factors like high blood pressure, as well as other risk factors I listed earlier. We know that sleep can impact. And one study looked at over 64,000 patients, and it found that the less than 21,000 insomniacs out of the 64,000 non-insomniacs. The mechanisms by which insomnia may lead to stroke are still not known. We do know that neuroinflammation can play a huge role that comes from the lack of sleep. Chronic stress and sleep loss may be another reason or elevated risk factor for having a stroke. And for patients with acute stroke, insomnia was not only associated with poor life satisfaction, but also with severe stroke, since the sleep absence can aggravate the brain damage and have neuro implications as well. And so we know insomnia is a huge issue, and it influences our inability to either get 2+ days of sleep. Before the diagnosis, the patient would complete a sleep history, and these other inheritance status, where you're to the life was like that. And we can tell a lot from that. The symptoms lasting more than 3 months should symptoms, whether they're long-term or over 3 months or short term should be addressed with the provider. Now let's look at the number of hours of sleep that we should have. You can see here is an infant. The infants are going to sleep 12 to 16 hours a day. That's normal, right? The baby sleeps many hours, the majority of the day. But as we age, toddler, preschool, see how this decreases until we're an adult. Between the ages of 18 and 16, it's recommended 7 or more hours of sleep. But upon further research, they found out it's just as important not how many hours we sleep, but you don't stay in bed too long. So now we know that at the same age, newborns should not sleep less than 11 or more than 19. We go on beyond, and it shows you that the toddler more than less than 9 or more than 16. So down here, and for everyone in our room today, adults between up to 64, it's not recommended to sleep less than 6, but no more than 10. We should not stay in bed more than 10. Or if we're over 65, that goes to less than 5 or more than 9. So again, it's when we're feeling like we're not getting enough sleep, it doesn't mean we stay in bed all day. That's going to make it worse. So we have to stay within that range according to our age, which is usually between not less than 6 or not more than 9 or 10. There's all kinds of diagnoses that when you go to a sleep specialist, which there are, and they're very necessary. We have even in Kansas City, but there's all kinds of hundreds of sleep disorder diagnoses that we can determine. And sleep disorder is a professionally doctor diagnosis you in this particular sleep wave disturbances are maybe actual problems, but they are like the diagnosis. Now, the National Sleep Foundation does some wonderful research in this area. If you ever get contacted by them, I hope you'll participate in their research because that's where we find out so much information is from the National Sleep Foundation. They know that some of the common sleep problems are or bipackage, insomnia, restless leg syndrome, excessive sleep time, daytime sleepiness disorder. We know that there's about 80 different disorders and about 7 million Americans suffer from them. So it's a huge issue. That's why sleep, that specialty is sleep medicine, is becoming very key because we're seeing how this impacts all diseases. So what causes some of our sleep problems? It could be a medication side effect. Depression is huge. That's why we need to identify our anxiety, constant pain, breathing difficulties. So some helpful habits would be to, first of all, maintain a consistent sleep schedule. Get at least 7 hours a night. Establish a relaxing bedtime routine. Use your bed for sleep and steps, and train your brain to know how to go to bed and to go to sleep. Limit exposure to bright lights and keep the room comfortable and cool. Turn on the light for 30 minutes before going to bed. They address that in the film. The blue screens or the blue light is not good for our brain to try to settle down to go to sleep. So 30 minutes before turn on the screens. So sleep hygiene keep the room very dark. But this is especially an issue when we're night shift workers and we have to sleep during the day. There's special curtains, of course, you can buy. We need the room dark for ideal sleep. Turn off the electronics, and then the cool thing about the fan is that if you are cool, you don't run too hot. That's going to wake you up. They keep your room cool, and the beauty of the fan is that you need that white noise in the background to fall asleep. That fan will do that. It's not only keep your room cool, and it should have white noise that you may need. Now let's look at our diet. These are all things we need to control. The diet, don't eat a large amount before bedtime, eat just a light snack, protein would be great. So, light healthy, like a piece of cheese, yogurt, or something like that. Protein will, suffice you during the night. But, don't eat it heavy, like after Thanksgiving is feel so miserable, or after a big party late at night, you really pig out, and then you have difficulty, you go to sleep. That's because our GI system is going to keep us awake. It's trying to digest that milk, and it's not good. So if you're going to have a heavy milk, then try to move it up in the evening. Exercise helps a lot. Avoid caffeine in the late afternoon or evening, and that means not just coffee, but any beverage like Coke products or whatever. Avoid alcohol. You know, a lot of people think alcohol makes me, if I have beer or 2 hours, maybe go to sleep, and it doesn't keep you asleep. And the longer alcohol will prevent you from having good sleep. And then reduce your fluid intake before bedtime. And you don't want to drink the fluids all the way until bedtime. The alcohol might go to the bathroom, right? So we may want to cut that out earlier in the day.
You say exercise, like breathing that.
No, it's actually better to do it earlier in the day, just so you get some exercise in. That's rather than it's about 30 minutes. It's just for your normal sleep. But yeah, that's a great question. It's usually better to do it earlier because your body gets all revved up from that. So earlier, at least earlier, late afternoon, if not earlier. And so allowing, breathing is the core of life. So allowing the scientists for our bodies is calming, feeling calm and rejuvenating. We need to calm our body before we go to sleep. Breathing exercises can help better for experiencing anxiety or stress, and we can some breathing exercises before we go to bed. Shallow breathing is not good. Shallow breathing, even if you're waiting to see a doctor or patients about something, you're having a particular appointment, you start out our conversation. Shallow, look at your breathing. What are you doing? If you're having a real short rest, it's going to provoke that anxiety in the body. We need deep breaths. Deep breaths will calm us and make us less anxious. So deep breathing exercises. So you can practice. Turning Point does a lot of deep breathing or deep breathing. Yoga, Tai Chi, those kind of exercises. Not only to get your exercise, but you also can learn some of these deep breathing skills. Meditation is a great if you use guided imagery for meditation, it's great. And guided imagery where you take yourself to the beach or mountains or whatever relaxing to you, those are all really great. And another relaxation technique is like prayer. A lot of people maybe go to say prayers or whatever. It's a very soothing thing. So anything that will make you breathe deeper, and sometimes you just have the purpose. That's what these exercises, if you ever want to learn them, they'll take you through, take 4 deep breaths, and they'll walk you through it. I wanted to show you this. I want that guiding things that you don't know, because these are expensive pillows, $150. But there are new technologies out there. And through the pillow, we can have sound waves. And the sound waves resonate with the pillow, and it enhances. But like I said, I'm not advocating that you go by that, because you can go to your phone and you have sleep sounds there. And I just told you to turn on the phone 30 minutes before. In this case, though, if you need to calm the sounds to go to sleep, you turn it on over so that you don't have the blue light interferes with our brains. So find your calming sound and then turn the phone over so you're not bothered by that blue light. But you can see this with this, these are all sleep sounds. And, you know, you can find you want, ocean sound, rainfall, thunderstorms, ban, there's the ban. Wind, rain, all and on, just for sleep sounds. So there's a whole ton of them in there if you want to try something like that. And it's on your phone. This is one, there's some readouts out of the telephone, and you have to pay for it after a certain amount of time. But that is one of the big ones that you can try. Now, let's look at medications. We know that medications can be a big thing. You want to be friendly with your pharmacist, because if you think that your medications may be interfering with your sleep, and there's a lot of interactions, we need to talk to our pharmacist about when we take certain things, because you don't want to take prednisone late at night. It revs your body up. It's not going to relax you. You want to move that to the day. Yeah, Neurontin is another one. There's sometimes the interactions of our medicines that we need to make sure we're taking them properly at the right time. So talk to your pharmacist, they're experts in that interactions in all different meds. Now, if you are pain, when I said earlier, pain is an urgent person. If you are in pain, that you have to have time to take it. Is at nighttime, because usually it will help you sleep as well. Right? So you're getting the development of reading and pain and helping you sleep at night. So that's very good. But anyway, some of the drug medications can affect your ability to fall asleep, like the beta blockers, diuretics, clonidine. Some of those may interfere also with the SSRIs, the serotonin inhibitors. So, not that you would know all this according to it, but that you're taking what your pharmacist would know. And if it doesn't say specifically on the label to take limitations, then ask your pharmacist. That will help a lot. Now, some general sedates. Sedating is antihistamines like Benadryl, nighttime Tylenol, those kind of meds, and the song. They can help you with melatonin, helps. There's a newer herbal supplement called valerian, which helps. And, but you should run these by your doctor, because for instance, Benadryl, we can all buy Benadryl right now, it's 25 to 10 milligrams. And it will help you sleep. But if you have glaucoma, COPD, asthma, and other disease, you should not be just randomly taking Benadryl. So all these drugs can still, even though they're over the counter, so they may not you should still talk to your provider, the doctor about that. And it's not, none of these are recommended for more than 2 weeks. So if you can temporarily like doctor something stressful, or something that's happening with the life, see the little touch to get better, so these are wrong. But over 2 weeks, duration of taking this, you can address it with the doctor to see if there's something else that we can better for it. Number one, you can, like Benadryl, as I said, that you can kind of take it to the Benadryl, causing another issue, but you know, so sleep aids are short term, not long term. Also, alcohol was mentioned earlier, and recognizes some of the side effects of these drugs could be disorientation, or it should be driving. Okay, and the longer we take, the more tolerant. So I start off with the innocent drug 25 of Benadryl, maybe 15 or 75. You do become tolerant to being lavender is another what I want to say, a holistic that you can use. It decreases anxiety and lets sleep. There's few side effects. It comes with pill and vapor, oil, actions, energy, things. So lavender is really that is. They even use it, get it for a diffuser, or put some oil on your alcohol on your bedside, but it's flammable. The way you like the candle and put the lavender oil together, getting some so make sure the use of oil that is, the infusion has 60 inches. And, our chemical, and I want to show you this. So the one of some of these farm herbs are, a holistic way to do all kinds of things, not just sleep and, all different kinds of symptoms. Symptom management. You can go to this NAHA, National Association for Holistic Aromatherapy. And that's where you can find their guidelines, but like lavender is great for sleep. What else is out there for back symptoms? So it's a very reputable source for you to look at. So this just indicates that if you maintain a consistent schedule, and you have those deviations because there's a graduation party, retirement party, Thanksgiving, holidays, and you have those interruptions in the sleep you have less of an issue if you maintain that. If you go into, if you already have established good sleep hygiene, like I talked about earlier, these infrequent interruptions, especially these will be less impactful. You'll still feel better than if you didn't go in and sleep hygiene. Again, I reference the National Sleep Foundation. They're very good. They do research, so if you ever get qualified to participate, you're very credible. And there's all this research. And their national, sleepfoundation.org. Now, I just want to show you this because if anyone wants to make sure that you get it. But if you go to your doctor and say, I'm having trouble sleeping, he goes, well, how many hours do you sleep? Blah blah blah. This is a very to say I'm not sleeping well. What does that mean? For me, it means something different than it is for you. So to put it objectively, something like this converts that that qualitative language of not sleeping well or sleeping poorly into very objective information. And this just shows you. So let's go through the sample. So this is Monday, it's a work day as opposed to a weekend or an off day. E is I exercised at 1, A is I had a glass of wine at 6 p.m. This line here at 10 is when I went to bed. I didn't go to sleep, it took me 90 minutes to fall asleep. So from midnight to 4, I slept. I was awake for an hour, then I went back to sleep from 5 to 7. At 7, I drank my coffee or my caffeine and took my medicine. Now, what this will tell, first of all, it's going to give the doctor or your provider very measurable information. Say, oh my gosh, one clear thing is maybe this scan for medicine should be pushed up through earlier in the day. Maybe it's not conducive to sleep, like prednisone. If you take it too late, it is going to interfere with your sleep. Maybe here, maybe if I pushed up my fluid intake, I wouldn't get enough water to go down. Maybe I can play around with it. So you can use this, or you can play around with it. Like the E exercise, if I was doing that in the evening, I could never go to sleep. That may show you why you're having difficulty sleeping. Anyway, it's just a nice tool that you can play with yourself and take it to and show the doctor. I'm telling you that I'm only sleeping between midnight and 2 and I'm not the rest of the night. So it's just a useful tool that you can use. So if anyone wants to just let Sarah know. Now I'd like to show you this. I want to make sure yeah, I think
Is going through hearing, so it's like.
I just take questions.
Are you sure?
Yeah.
Okay.
It's just was just kind of a summary. So instead of doing that, let me just take questions from the group or any comments, anything that you would like to share.